Welcome into the Loyola Sports Medicine Injury Update Minute here. We got with Dr. Tonino, the Chief of Sports Medicine at Loyola. We are in super casual gear because we're down here in Bourbonnais on the field at camp. And Doc, before we get into maybe some of the injuries that could affect the team this year, let's go back to last year and talk about the 19 guys that were on IR. What goes in to a medical staff and a team from the end of last season to the start of training camp here?
Well, you're basically doing an inventory, trying to figure out like which kind of things you could prevent and which kind of things you couldn't prevent. So see if you can do something better next year for prevention standpoints. Unfortunately, last year, most of their injuries were bad injuries, bad actors, things that they really couldn't prevent and just happen when you play a contact sport like that. If there were some other ones they think they can prevent, this is a good time of the year now to kind of work on that and see if you can do something a little bit different with them.
All right, we'll talk about some of the guys in a minute, like I said, but what does the communication go on, or how is it with you and the coaches, or maybe the medical staff as well, with some of these guys that are coming off these major surgeries?
Well, you have to explain, I mean, there's different kind of things that you do at surgery, kind of explain to them that not all arthroscopy, for example, is the same. You may have done something differently with one player that'll take longer for that player to get back. Because they don't have the complex medical knowledge that you have, and they're just trying to figure out when their guy is going to be back to play. And you want to do that, help them kind of get that information so they can plan. If they know somebody's going to be out for 3 months or 2 months or if they're going to be back in a week, they need to know that for planning purposes.
And then if you're out here at practice or you're watching your teams, or your eyes on those players a little bit more to make sure that they are comfortable out there and maybe progressing like they should be?
Anytime. Even if you're on the sideline and you release a guy, say, I think you're good to go back in, you have him run up and down the field a little bit, cut a little bit, you look good. I always keep an eye on their number and keep an eye on them on the field, make sure they're doing okay. Especially guys nowadays with concussions, if they had a little bit of a head injury, they say, I'm okay. Everybody checks them out, say they're fine. You always look at them and make sure you're keeping your eyes on them.
All right, Kevin White, he hasn't been on the field really for 2 years. He's had the same, I believe, spiral fracture twice. What do you look for him coming out of that, his second time, in your medical opinion?
Well, I mean, it becomes a psychological kind of thing right now, too, for any athlete. Some of them have never been hurt until they get hurt when they're playing pro sports, so they don't know how to take it when they're injured like that. So it's partially working on psychology with them. The trainers who are working with them, conditioning guys, are making them do stuff that's very similar to what they're going to need to do on the field. And at the end, if you think that they're ready to go, you kind of tell them, well, and make sure that they feel like they're ready too. Whenever we release someone for an ACL injury or ACL surgery, we do psychological testing and ask them if they're ready to go back and play. And you may think everything feels okay, but they don't score very well with that. So you got to work on that kind of by making them, again, do similar things like they're going to do and make them feel like they're going to be okay.
Yeah, there's stories of his coaches doing that as well, showing him his old tape from West Virginia to kind of get him mentally back to where he was and his confidence right. Kyle Long is another key one. He went down with a major ankle injury, and I also know he has a labrum issue that he did not take care of because his ankle surgery was, I guess, so severe. Is that one of the worst injuries to have, an ankle or a knee worse, or how bad is an ankle injury to have, especially as a big guy?
Well, the ankle injury itself is very debilitating, particularly for a lineman like that who's got to be able to squat down because you have to bend your ankle back like that. And his kind of surgery is usually something that it takes a little while to get back from. As far as the shoulder is concerned, he didn't get it operated, but there's different kind of labrum tears in the shoulder. There's something called a slap tear or superior labrum tear.
Had one.
Yeah, you had one, okay. You don't need surgery for that a lot of times. People say, oh, you got a slap tear, bring you to the MRI. Yeah, I got a tear, I need surgery. No. Not everybody needs surgery for that kind of stuff. So I'm sure the doctors are looking at him. He looks okay, testing him out, and think that he's ready to go for that.
And finally, Danny Trevathan. He had just a severe knee injury, the patellar tendon tear. I've done my ACL. I've heard that injury is worse than an ACL. Is that true? And then how hard is that rehab?
I think they're all, women always compare having babies to kidney stones. I mean, every injury is very debilitating, but we know that recovery from a patellar tendon injury like that and a subsequent surgery is not really great. But I never like to bet against players. Some of these guys will make you look bad.
Genetics.
Yeah, the way they're built and stuff, and mentally they can get over with stuff, and even performing 90%, you don't even know that they're not at 100% because they're such gifted athletes.
Yeah, out here at practice, I was shocked. I got to watch a little bit of him going through individual drills, and he looked pretty darn explosive. They haven't, I think, completely released him to the wild yet, but he looks pretty good. And Doc, thanks for coming on the show. We will see you at the Chili's in Vernon Hills. And stay tuned. We'll have more Chicago Huddle right after this.